Governor Jared Polis is providing an update on the state's response to the COVID-19 pandemic. This comes amid a string of 10 straight days of more than 2,000 new cases here in Colorado. Let's listen to what the governor has to say. Governor Jared Polis is providing an update on the state's response.
With somebody who has COVID every week. So treat everybody like it might be that person who is contagious with COVID because you might not know who it is, and often you won't. They're pre-symptomatic. They develop symptoms a day or two later. They're asymptomatic. And now is the time to reduce our social interactions. Just cancel those social plans with other households. Socialize with people in your own household. If you live alone, maybe identify 2 or 3 other people that live alone as part of your bubble to socialize with for the next few weeks. But it really is those, because when somebody in a household gets it, usually everybody gets it. So it's really those inner household interactions that need to be avoided for these next few weeks as we enter this very difficult period where we have over 1,000 hospitalizations currently in Colorado. I'm sure many of you heard the very good news this morning. The Pfizer vaccine is effective at over 90% of the time. That's a very good number, just to put that in context. Flu vaccine, more 50, 60% range. 90% plus is sort of the gold standard for vaccines that work. If enough people are inoculated with a 90% effective vaccine, it ends the pandemic. 50%, 60% effective helps, but doesn't end the pandemic, right? That's how effective the flu vaccine is. People still get flu. But these are kind of, again, the gold standard. Think, measles and mumps, and many of those vaccines are in that 90% plus range, and they're not eradicated from the earth, but outbreaks are very limited, often contained early because of successful mass immunization. So really good news on the Pfizer vaccine. But it's also important to know that we are not out of the clear yet. We are not inoculated yet. The vaccine will be approved. We're hopeful there'll be some dosage in 2020, likely in the low hundreds of thousands for Colorado, could be 100, 200,000 submitted, most vulnerable and others. But for most of us, it means early next year for inoculation. Could be January, February, March, could go into April or May as progressively more and more of us are able to get that shot till enough to end the pandemic. So the other important thing to note is you're not immune the minute you get this shot. You have to have 2 shots spaced apart by about a month, and then another couple of weeks till you're immune. So it's a month to 2 after you get that first shot that you have the immunity. So look, what this means is we talked about the marathon, right? The end is in sight. You can see it there. You're a mile or 2 away. We've been through the duration-wise most of it, but we're tired. But now's the time to find that renewed energy to sprint. And what does a sprint mean here? It means cancel your social interactions, be safer at home or in the great outdoors, wear a mask whenever you're out, wash your hands whenever you get back from anywhere with soap, like more so now, because this is going to get worse before it gets better. We're at the end, we're the most tired. The virus is the most prevalent it's ever been before in our state and in our entire nation right now. And I hope that seeing the vaccine coming that works will give us that energy to do more social distancing, which is hard. Humans are a social animal. We like to be around one another. I have a 87-year-old friend that was a good friend of my late grandmother that I communicate with regularly. She's in senior living and hasn't seen any can't see loved ones or friends, hasn't for many months. Really, really tough. But she keeps up on email regularly, on phone. And, of course, she's looking forward to many, her cohort being among the first to get the shot and be safe. And we're just bear with it. Bear with it. It's time to buckle down and successfully isolate for a few more weeks and months here, reduce social interactions with other households. And light is there. The end of the race is there. We really just need to do better these next few weeks, next couple months. Wear a mask, avoid social interactions with people outside your household, physically distance from others, wash your hands regularly. I can't stress enough the importance of doing these things right now. And I hope that the good news about a vaccine inspires us to double down on social distancing in Colorado for the next few weeks and months, rather than sustain these unnecessarily large number of fatalities and hospitalizations that would ensue from stepping back from what we know works. People know what works now. You're smart. You know what works. We just need the resolve to not let this virus win, the resolve to save lives, the resolve to get our economy going sooner rather than later, and together that we can do it. And if we can save lives, and I know we can, it's worth it. Could be your aunts or your uncles or your grandparents or your moms or your dads, your sisters or brothers or your friends. Could even be your own life that you save by canceling your social plans for the next few weeks, washing your hands regularly, wearing a mask whenever you're out. With regard to masks, today I'm announcing that statewide we are extending the mask mandate for another 30 days. With the rate of the virus the highest that it's ever been, it's more important than ever before in the course of the pandemic to wear a mask when you're around others. At the store, walking in or out of restaurants, in a workplace that people have to be there and can't telecommute. Masks are not as effective as a vaccine, but they're somewhere in that 50 to 75% range. It depends on the mask and the distance and the situation. You are far safer by wearing a mask, and you also protect others if you yourself might be asymptomatic or pre-symptomatic from spreading it and preventing an outbreak with those who you work with or those who you love. So we're going to continue that. I also wanted to address and applaud a lot of the efforts that local governments are taking. Each community in Colorado is experiencing the pandemic differently at different times. In Mesa County, Colorado, they're experiencing the very first wave of coronavirus. In areas like Denver, they're experiencing the largest wave, but it's the third in effective time that it's peaked, and it's at greater rates now than it was in March and April. In March, we needed time to prepare and to learn the practices to save lives and of course, the science and data about the virus. We have great leaders in local government that are looking at really getting a handle in their communities. And there's many communities across the state that are making hard decisions to reduce the spread of the virus, save lives, get their economy open sooner rather than later. Counties like Summit and Adams that have a 10 p.m. curfew. Denver residents also in Denver only interact with members of your household is the municipal order. Many other counties have taken nuanced measures, testing, education, mask wearing campaigns. But look, this shouldn't be confusing to anybody because it doesn't matter where you live in our state. No matter where you live in our state, avoid social interactions with others outside your household these next few weeks. Wear a mask whenever you're out. Physically distance at least 6, 8, 10 feet from others where you can, and wash your hands regularly when you return from a time that you had to go out. Doesn't matter where you live. Doesn't matter what the city or county says. It is the highest prevalence in our state that it has ever been. How do we defeat it? How do we get those numbers down? Number one biggest thing, avoid social interactions with other outside your household. Somebody asked me earlier, is dining is going out to a restaurant safe? Well, there's different degrees of safe. And if you're at risk, the safest place to be is, of course, at home. But dining outside, relatively low risk. Dining inside, low to medium risk with the spacing requirements that they have. But the single biggest risk is who you go with. The single biggest risk is if you're going out with people that are not in your household, because 1 in 100 are contagious right now, many without them knowing it. It's like playing Russian roulette with a loaded gun with COVID. Is it possible to encounter COVID if from a masked waiter or waitress coming to your table for a few minutes? Sure, it's certainly possible. But the transmission is a much higher likelihood for the people that you're dining with. Could be in your home, could be at a restaurant, could be at their home. And of course, you're eating without your mask, you're across from them for an extended period of time, could be an hour, hour and a half. Very, very high risk of transmission. So that the most dangerous decision is associating and being close to for a long period of time people from outside of your household. Other activities remain low to medium risk, but the high risk is being in close proximity with others that are outside your household. It doesn't matter where you live, no matter who you are, no matter what the rules are in your county. In addition to creating the framework, we've also increased our supply of personal protective equipment, masks, gloves, et cetera, considerably. Unlike in March, we all know how to not get this virus now. Avoid interacting with people outside of your household, wear a mask around others. We just need to have the resolve and the discipline to reduce your exposure risk and the exposure risk of loved ones. We've also increased testing substantially. It's a key part of minimizing the spread. Back in March, when this began, I think there was a period when it was brand new where our state lab was running like 160 tests a day. The state lab now runs 8,700 tests a day. And we hit a record of over 38,000 tests across the state in a single day with our private partners. That's growing all the time. We partnered with companies like Curative to increase testing in long-term care facilities and rural communities. Our first 2 COVID-19 testing kiosks are open, one at UNC in Greeley and one at Denver International Airport for their employees. It's self-administered. You swab the inside of your cheek and it's put in a secure container. We have hundreds of thousands of instant tests available. These are less accurate, but they have a very important role in screening. So look, if you are experiencing symptoms or you think you might have been exposed, get tested. COVID19.colorado.gov. There's over 80 testing sites all over the state. We'd like to increase those numbers even more in the days and weeks ahead. We're working with Curative and Mako, 2 of our partners, to launch testing vans that can be located in hotspots to give us better ways to get testing up in communities that need it. We're going to have a combination of over 10 Curative kiosks and mobile testing vans throughout the month of November. As these become available, the site will be updated at covid19.colorado.gov to let you know where you are. And we've launched tools, and I appreciate the work over the weekend of the testing team on the database side for the spreadsheet on the quick rapid tests, which are a very powerful tool for ongoing screening of people that are around others, both coworkers and clients. And that is a new and powerful mitigation method that we simply did not have in March and is coming online rapidly. In March, we had less than 3,000 N95 masks and no KN95 masks. Today, we have 9.7 million KN95 masks, 640,000 N95 masks, 10 million surgical masks, 3 million face shields, 1.2 million hospital gowns. So we've done this through a combination of opening up our own supply chains with suppliers and working with the federal government. We are in a stronger situation with regard to the necessary equipment to prevent those frontline healthcare workers from being exposed. We also, while we remain concerned about our hospital capacity and over 1,000 patients is extremely alarming, there have been great improvements in the clinical management of COVID-19 patients. The average hospital stay has been reduced 1 to 2 days. And a shorter hospital stay means that beds are available for others, either with COVID or non-COVID related illnesses, but it's still in that 3 to 4 day average time frame, which also means for some it's 1 or 2 days, for some it's 30 days. Less, obviously, but the average is in that 4 day range. We have surge capacity ready to come online. We can activate the St. Mary's, Corwin, and St. Anthony facilities to free up hospital beds. We could also activate, if needed, the Colorado Convention Center as an alternative care site to avoid running out of space in the hospitals. Those are not yet needed at this point, but we watch that data in real time every day, and we hope that we never have to use those sites. And if Coloradans truly do cancel their social plans, avoid interacting with people outside of their households, then we likely won't need to activate those sites. But we stand ready to make sure that every Coloradan, regardless of whether you get COVID-19 or need hospitalization or care for anything else like a heart attack or stroke, we want to make sure that that best quality of air is there for you to give you a fighting chance of living. We're learning more about the virus every day. We know a lot more than we did 9 or 10 months ago. For example, we understand that there's a higher risk of contracting the virus indoors. We know that we encourage people to be outdoors and even through winter, and the statewide mask order pertains to wearing mask indoors. We also know that Coloradans understand better how to avoid getting the virus, despite the uncertainty surrounding the pandemic. Through the work and words and wisdom of Dr. Fauci and Dr. Birx and so many other health leaders, we know that we can protect ourselves and those around us by wearing masks, physical distancing, washing our hands, limiting social interactions outside of our household. And we know that Coloradans can do this because you know what? We've done it before. We saw a smaller jump after 4th of July, after Labor Day, but we got that spike under control. And we prevented them from becoming larger by working together and doing what you know you need to do to slow the spread. That's how I know we can do this again. It's a little harder because we're tired. It's been 20 miles, 21 miles. We're exhausted. We need a little bit more discipline here. I know that we can do this, Colorado. And the state of Colorado, well, as always, we want to lead by example. And when the numbers were looking better statewide, the Colorado state government was starting to return to some in-person work at reduced levels. But today we're announcing that in our effort to change the trajectory of the virus, state employees, with limited exceptions, will be working remotely through at least the end of November and into December at the highest level that we can sustain. And I want to, again, applaud and thank those state workers that cannot work remotely, the folks who today is some snow, the folks that are from CDOT that are clearing the snow, the folks that are guarding our jails, protecting our streets, state troopers, so many others. Thank you for the work that you do and the fact that we understand and acknowledge the fact that you can't work remotely, as we do with many in the private sector and grocery and retail stores and in factories and in other areas. But for those who can't telecommute, we are doing it as a state to the maximum extent possible. And I want to encourage private sector employers to follow suit the next month or two. We were hoping that we could be back and have that limited water cooler talk by November. There is value in seeing one another, but the light is there at the end of the tunnel. We're almost at the end of the marathon. Let's keep it up and do more, succeed more social distancing, to change this trajectory here in Colorado before it overwhelms our hospitals. So we have the tools to fight the virus, but at the end of the day, it's up to you. No matter what your state or local government has or hasn't put in place, each and every one of us has a responsibility to do our part to protect ourselves and protect those around us. Colorado, we need to cancel our social plans with others outside of our household. It's just that simple. It's not easy. It's tough. It's tough psychologically. It's tough socially. But we simply must alter our behavior to flatten this curve and keep one another safe and prevent our hospitals from being overwhelmed. It's time to buckle down. We've got to change the status quo in the final few miles of this marathon. Together, I know that we can change the course and get our state back on track, save lives, save our economy, save ourselves. With that, I'll go to questions.
Governor, good afternoon. It's David Clue with Denver 7. With COVID cases breaking records almost daily now, and despite your weekly news conferences, why are you still reluctant to set mandates to curb the virus beyond masks? Is it not clear that many Coloradans are simply not listening to you?
Days. What convinced me to do that was simply the fact that areas that had mask wearing requirements had higher mask wearing than areas that didn't. Apparently, there were people that were sitting around not wearing masks, waiting for Governor Polis to formally tell them to wear a mask. I thought that encouraging them and giving them the science would be enough. Masks offer about 50 to 75% protection, depending on the kind of mask when wearing properly. Obviously, KN95 and N95s offer even more, but those are harder to get, and we prioritize medical personnel. We also, of course, have strong safety guidelines in how different kinds of businesses can function safely. We encourage all of our small businesses to take those seriously. When a small business or a large business isn't playing by the rules, they're not just jeopardizing their own employees and clients, they're jeopardizing our economic recovery, because a setback that overwhelms our hospitals could lead to an entire city or entire region having to shut down for a period of weeks to avoid overflowing the hospitals.
Hello, Governor. I'm Jesus Carrasquel from Noticias Univisión Colorado. Governor, in Spanish, muchos condados están descubriendo que gran parte de los brotes de coronavirus es en fiestas privadas o fiestas familiares. ¿Qué piensa hacer usted al respecto y si todavía consideraría cerrar el estado o hacer algún toque de queda?
Como he explicado hoy, nuestro estado está en un lugar completamente diferente al que estábamos en marzo, cuando tuvimos toque de queda. Es la cosa más importante, no conversar, tener fiestas con personas que no están en el mismo casa de ustedes. Casi uno en 100 personas en nuestro estado todavía tiene coronavirus. Pero si llegamos al punto en donde necesitamos hacer un toque de queda para salvar vidas, lo haré.
Hi, this is Sloan Dickey with Denver 7. I just want to follow up on my colleague David's question. I guess my question is not necessarily for the people that are following the rules or waiting for some kind of guidance from the government, but we've seen large gatherings and people not wearing masks for months now, people blatantly not following the rules. Are words from officials like yourself having a diminishing impact on people? And does some sort of enforcement for the people that are not following the rules on purpose need to be taken into effect?
Well, look, people are getting tired of this, and we're all tired of this darn thing. But that doesn't mean the virus is tired of us. Sadly, it's not. We have the highest rate of infection ever. So it is those kinds of get-togethers, both large gatherings as well as the untold number of small informal gatherings in people's homes and with others in different households. That's why we're telling people, we're arming you with the information you need to keep yourself and your family safe. Cancel your social plans with others outside your household. If you live alone, just pick 2 or 3 people that can be part of your bubble and socialize with for the next few weeks till you can go back to your normal larger group of friends. That's the way to beat this thing. It's simple. And it's not about enforcement other than it's about the Grim Reaper is the ultimate enforcer. More Coloradans will die if Coloradans don't simply cancel their social plans and wear masks in public. And I know that we can do it. We did it before. We can do it again. Everybody's tired of it, but I'm hopeful that the vaccine and the light at the end of the tunnel will inspire us in the final few months to do better.
Hello, Governor. This is Vinny Del Giudice of Bloomberg News in Denver. A White House COVID question. Will Joe Biden's election nudge the Trump administration to adjust its COVID-19 strategy between now and the inauguration, or do you anticipate status quo? Thank you, Governor.
Well, we enjoyed Dr. Birx's visit last week. She has been in close contact with our state. We've been on a number of calls with Dr. Fauci and other members of the coronavirus task force. We're certainly hopeful that a lot of the folks that are thoughtful about how we can rapidly contain this epidemic and begin the economic recovery phase sooner will hopefully be heeded by the White House. But we will certainly continue to work with the best science-driven data that we can get from any source within Colorado, from other states, or from other countries across the world.
Hi, Governor. This is Joe Vaccarelli from Denver 7. With the Pfizer news today that the vaccine could be a couple weeks away, what are the state's greatest challenges when it comes to vaccine distribution?
Well, the biggest challenge is our behavior now. We need to cancel our social plans, wear masks, and wash our hands regularly more than we have been doing the last few weeks and months. We've been simply seeing too many people, socializing too much. We've got to cut back. I mean, if you see 8 people a day, try to see 4. If you see 20, try to see 10. We just got to take this as a personal mission for each of us. The vaccine, we're very hopeful that there'll be the first dosages available in December. It seems likely. Those are prioritized for those most at risk. Wider dosage available early next year to help establish the immunity levels that will finally end this pandemic. And you also, by the way, we published our plan on the vaccine distribution in our state about 2 weeks ago, and I'd encourage you to check that out. We'll send you the link.
Hi, Governor. It's Mary Ann Goodland from Colorado Politics. What other tools do you have to get people to wear masks and take all those other steps? The only other one that we know of, I think, is just a flat-out stay-at-home order. But is there an intermediate step that you can take, and what would that step be?
Look, I focus on what is on us, what is on me as governor, what's on the state, and what's on you as residents. What's on us? Testing. We got the Binax instant test. We got rapidly expanding convenient testing across our state. We got the kiosks going up. So that's on us. We got down to a day turnaround, 2-day turnaround, most 90% of the time. The Binax test, 15-minute turnaround. Hospital space on us. Partners. We got St. Mary's, we got the convention center. We've worked with our hospitals to free up ICU and non-ICU beds. We can take additional steps around delaying more elective surgeries to free up more. What's on you? The rest of it. Who's going to tell whether you're socializing with your friends at your house? It's not Governor Polis. It's not your local police department. It's not your county commissioners. It's you. Cancel those social plans with others outside your household the next few weeks. That's number one. Number two, number three. Wear masks in public, wash your hands regularly. That's on you. We're going to do our part. State's going to do more testing. We have been 38,000 a day, rapidly available in neighborhoods, COVID-19.colorado.gov, kiosks going up, rapid testing being deployed, hospitalization, more beds. We're ready for more. But what's on you? To save lives, to get our economy going, avoid socializing with people outside of your household these next few weeks.
Governor, Charles Ashby from the Grand Junction Daily Sentinel. A couple of questions, if I might. First, to follow up on what my colleagues in Denver have asked about the social distancing and mask wearing. With a vaccine on its way and the anti-vaccine movement pretty big, particularly out here, are you concerned that we're going to have a problem with that? And two, since you're calling for people to minimize their holiday celebrations, are you in effect canceling Christmas?
So on the vaccine, I'm not concerned by folks who might not want to get the vaccine. We've been very effective in measles and mumps and other diseases, very high immunization rates. Most Coloradans are not only want to get the vaccine, but are the sooner the better that we can end this horrific situation and get our lives back, the better. So, and everybody, doesn't need to get it to establish herd immunity. We need to reach that, 70, 80% immunization rate with a vaccine that's 90% plus effective. So people are going to be lining up. The issue is going to be there's more people that want it than there are doses for the next few months. So right now, I'm hopeful that people are making plans for a safe Thanksgiving. What does that mean? It means to the extent you can, being careful. And if you're going to have a Thanksgiving, if you want to have a Thanksgiving with grandma, with grandpa, with aunt and uncle, the best advice would be to self-quarantine for 10 days prior to having that Thanksgiving. And if you're exhibiting any symptoms or fever, cancel those plans. But this is why we have a few-week window here to get this better under control so that we have a more normal Thanksgiving. Obviously, we're much more there'll be a very different epidemiological condition by Christmas. So as long as Coloradans are canceling their social interactions the next few weeks with those outside their household, together we can save Christmas.
Governor Chris Vanderveen at 9 News. I want to ask you, got pretty specific in terms of the vaccination plan for the state of Colorado, 100,000 to 200,000 by the end of the year, certainly more early next year. Where is that information coming from, one? And two, do you anticipate working more closely with the Biden administration on this or with the White House as the weeks and months start to come, particularly before January?
So the information was embedded in the release by Pfizer this morning. They committed to the number of vaccinations by the end of 2020. I mean, it's their estimate, not ours, but I'll find it here to get you the exact number. But anyway, it's their numbers. 50 million vaccine doses in 2020 is what they cited. Colorado, roughly 2 to 3% of the national population. So, and then I gave you a conservative figure in that 100 to 200,000 range. If they truly deliver 50 million, that would be higher than it'd be a few 100,000. But that also includes like the last week or two of December, and those might be administered in January. So I have a high degree of optimism based on the public announcements by Pfizer that we're in the low hundreds of thousands in December, 100, 200,000. I hope 300,000, but whatever we reach, the more the better. And then many more over the following year. There's a change of administration in Washington. Hopefully that doesn't affect one way or the other the vaccine. The relationship is with the private provider. We certainly hope that there's additional support, particularly with the Pfizer vaccine around the cold chain management. There's been offers of military support with regard to cold chain management. It doesn't matter which administration there is. We will work closely with the private sector partners and any part of the federal government, including the military, that wants to help with distribution to our state as soon as possible.
Hi, Governor. It's Jessica Seaman with the Denver Post. You talked about how since March testing has been scaled up. Can you tell us where we are with contact tracing, particularly how many people in the state are doing contact tracing?
Yeah, and the Pfizer, by the way, announcement, 50 million vaccines in 2020, up to 1.3 billion in 2021, which is more than enough for every man, woman, and child. And I would point out that this is just one. This is just Pfizer. There are several others that we hope to be hearing about in the next few weeks. Could be less effective, could be more effective. Quantities could be less or greater. So, there will likely be several different vaccines at a given time, and then over time there'll be an even more effective one. What your question was about? What again?
It was about contact tracing.
Yeah, I'll refer you to our team on that if you want the hard numbers. I don't have them in front of me, but we're happy to talk about our surge of contact tracers, the folks doing it, the difficulty and the strain they've been under with the increased caseload, and how that's done. The flip side of that is, and what I want to encourage people is, if you get contacted by a contact tracer, if you get called by one, please take the call. Please talk to them. Please honor a quarantine if you're quarantined. This is how we win. It's not just the contact tracing. It's people being willing to quarantine who are exposed. It's both of us, right? Knowing isn't enough. Acting is enough. We also have the app that's been downloaded by a record number of Coloradans. There's the automated contact tracing to reduce the need for humans to be involved and increase the availability of contact tracing and information. Okay, now, if you have any additional questions, get them into Elizabeth and Connor. We'll be happy to, on the specifics of contact tracing and numbers, happy to follow up with you on that. Over 1,000 of our fellow Coloradans in the hospital. It's a tough time. Our prayers, our thoughts are with everybody who's fighting this, and our condolences and our heartfelt sense of unity and solidarity is with the over 2,100 Coloradans and their families who've paid the ultimate price from this deadly virus. Let's stop this bloodshed. All that's being asked of you is to cancel your social plans with people outside your household the next few weeks. You can do that. You can do that. Our kids wanted to have a play date. We canceled it. They can have a play date in a couple months, next month, right? When things are better. But now's the time to buckle down. Thank you.
Governor Polis making a few announcements this afternoon regarding the state's response to COVID-19. The governor first announced that he is extending the statewide mask mandate by another 30 days. No surprise really there. He also announced that state employees will work remotely again through at least the end of November and possibly into December. Polis said that we had another day in Colorado of over 3,000 new coronavirus cases, and we have over 1,000 Coloradans in the hospital right now. That's about 80% of our ICU capacity. This all comes on the same day that Pfizer announced that they have their vaccine is 90% effective. They think with FDA emergency approval, they can get 50 million vaccines out to across the United States by the end of the year. Polis said that he is hopeful that Colorado will get at least a few 100,000 dosages of that vaccine by early next year, or early at the beginning of 2021. Stay with us as we continue to follow the state's response to COVID-19. We'll have a full write-up on the governor's press conference on thedenverchannel.com.